our subject of recognizing hoarders and seniors and kind of going from there. I am Darlene Mahoney, and I am the National Digital Sales Director with SeniorLivingGuide.com. And I also host a podcast called SeniorLivingGuide.com podcast. SeniorLivingGuide.com is a national reach website. It is designed to help seniors and caregivers find senior housing resources that best suits their needs. It connects them directly with the communities or home care services in which they are specifically looking for. It just deletes the middleman completely, and that is really what our website's created for. We also have print publications that are statewide in North Carolina, South Carolina, Virginia, and Florida. We also have hospital directories, I think, in 43 markets. We have that, and then we have our webinar series. And then, like I mentioned, we have our podcast. The podcast is, as podcasts are, they can be listened and downloaded anywhere. Some of them have some international reach, which is kind of fun. The podcast itself is also designed for seniors and caregivers as a resource of information. It can be found and listened to anywhere you listen to music or podcasts such as Spotify and Apple Podcasts. We have a range of topics that can be anywhere from sex after 60 is nifty to caring for someone you don't like, nutrition, dementia. We just did one with Ann on hoarding. So if you liked this, the podcast on hoarding is amazing as well. So there's all kinds of topics. So go check that out. And that's pretty much about us in a summary. And I'm always available if you have more questions. And I'm going to let Ann take it away.
Thank you. I was just saying to you that I had been on with the police before we picked up on this. Sometimes the police are involved in hoarding situations also, and we'll discuss that later in the session when we start talking about animal hoarding.
Okay.
But my background, which is kind of an interesting blend, I am a senior real estate specialist. I have been a realtor for over 30 years. And in addition to that, I am an educator with a PhD in educational leadership. And I'm now devoting my time to helping vulnerable seniors and also to educating the industry, to educating families, to educating the population about the realities of hoarding and what can be done, and also how significant it is in this country. Just briefly to get started, I was saying that usually the research shows that there are between 2 to 6% of the population are identified as hoarders, which would mean that out of every 100 people that you know, maybe 2 to 6 of them might have hoarding tendencies or in fact full-blown hoarding disorder. The phone call that I was just on with one of the police specialists in the Lauderdale area was to tell me that he thinks the hoarding, what he has seen, is far more prevalent than we know, and that he would guess that 15 out of every 100 people that you know may be in severe problems because of hoarding. So wow. Yeah, that was kind of an opener. And one of the fascinating things is the more I delve into this, the more I learn and I get different perspectives from the people involved. And we were talking a little bit about what the police's role is and then how I can come in as a specialist to help them. But I just thought it was interesting that he thinks it's even far more significant than the research is identifying.
Right.
Go ahead, darling.
I was going to say, because I would imagine that there's so much that's not reported, that's not talked about. I don't want to call it a dirty little secret per se, but it's probably something that if it's happening, you just if it's happening within your own family, you may just allow it to happen. You may not be dealing with it. First of all, it's such an overwhelming thing that sometimes it's easier to just say, hear no evil, see no evil, speak no evil. You just walk past it and move on because it's just can be so overwhelming to deal with.
Well, that gets to, in the next slide, please. The next picture. There we go. Here is the real issue. Can collecting become hoarding? and what is the line between collecting and hoarding. And these are actual pictures from clients' houses that I have. This particular individual involved collected, and I'm using the word collected because that is her word, collects cats. These are not live cats, but these are figurines and stuffed animals of cats. When I went to visit her, she has over 5 rooms full of these figurines and stuffed animals, and she even has cat sweatshirts, et cetera, et cetera. Now it seems like a kind of trendy, cute collection that she
Yeah,
has.
kind of kitschy. Yeah.
Yeah, well, except for the fact that those are the sofas she's supposed to be sitting on, which is actually the definition of hoarding and hoarding disorder. What is the distinction between collecting and hoarding?
Mm-hmm.
The distinction is when it interferes with your life,
Mm-hmm.
then it becomes a hoarding issue. If you can't get through your house, can't get through your house because it's too cluttered, it's probably hoarding.
Right. And my thought is what is the overall effect on your budget, on your bank account when, I mean, if you're living off of Social Security, or you're living paycheck to paycheck, or you're living on a tight budget, this is an investment.
Well, next slide, please. Hope everyone can see this one. If you're poor, it's called hoarding. If you're rich, it's called collecting.
See, I didn't even catch that, and I'm just a genius. So yes, so the previous slide, and you and I have talked extensively about hoarding and identifying hoarding, and clearly we're going to talk about how to best approach it and understand it and help those with compassion, especially seniors specifically, that have these issues. But identifying it is the key. On, like you said, what's the difference between collecting and hoarding? But the previous slide, one thing that I thought was interesting, when we talk about hoarding, we always think of the show Hoarders, and it's like garbage and paper and all this stuff, and you can't go through the house. In that previous slide, while this particular person had, tons and tons and tons of stuff just on every surface, other than that, she looked like a neat neck. I mean, it looked like it was clean per se. There wasn't stuff everywhere. I think that that's an interesting note, because typically when you think of hoarding, that's not what you think of.
Well, it becomes hoarding by the definition when you can't navigate through your house. Mm-hmm. When you can't sit at the dining room table and have dinner because it's covered with figurines. That's when that impact is really where I draw the line between hoarding and collecting. And oftentimes I see situations with people who are quote unquote collectors. And as I look around and examine the situation, I say somewhere along the line, it's going to cross over. It's going to cross over into the hoarding. And then you get the rooms with the goat paths through them and that kind of issue. And yes, you've brought up a good point. Socioeconomically, it can hit any level. Mm-hmm. It can hit any level. It's not just poor people that are.
Yeah, and you could start out as medium income, but hoarding can make you become poor.
Well, there are some situations where people buy large amounts of things, mm-hmm. and then it becomes an economic burden, or they buy tons of food that they can never eat. Mm-hmm. And we joke about, did you ever see the lines at Costco's in the morning with the cars? Yeah. What are these people buying? Most of them live in little condos in Florida. Yeah. Where are they going to put all this stuff? And what are they going to do with it? And that's when it begins to have a real impact on people. If you go to the next slide, it'll show you the definition of hoarding. And this was developed, can you see the whole slide there? This was developed when they no longer consider hoarding just obsessive compulsive disorder. Mm-hmm. The psychological information now gives it its own categorization of hoarding disorder, because usually in hoarding is a symptom. It's a symptom of other psychological problems that are going on. You're never just quote unquote a hoarder or quote unquote a collector when it becomes, excessive.
Right.
Usually in dealing with clients, I find I may be called in because there's hoarding, but there's other stuff going on. There are other issues that have to be addressed, and people have to remember that when they're working with hoarders. You can't clean a hoarder's house up and think that you're going to solve the solution, which is why I kind of have not a real favorable impression of the reality TV show. I know you and I have talked about it. It doesn't give you any solutions. And without solutions, hoarding will just happen again, or we'll get to the point where it interferes with someone's health and well-being. So I think the principle that we're talking about.
Yeah, I know that we even talked about, some of it can be like slight hoarding per se, and can be a generational type thing. Like I remember my grandmother, no matter what, and even when she was just living alone, had more food than she could possibly eat. You mentioned the Costco thing. And I think even when it would expire, she wouldn't get rid of it. But she grew up during times of depression where they didn't have food a lot of times. And I think that was her comfort of knowing no matter what, I'm going to have food, even if it's expired, even if there's no thought that we're going to, it's just, it was something that I think was ingrained in her from that life experience as a child. But I don't think it was something that, it wasn't so much hoarding that it was, you couldn't move or get through, but it was amazing to me. You'd open this woman's pantry and there was just insane amounts of food, the refrigerator, insane amounts of food. And you would have to sneak the expired food into the garbage because she just did not want to get rid of it.
I think as you brought up the depression, and that certainly was a sign of people, having a difficult time. I think that COVID and the onset of COVID and the isolation created by COVID has really made this a pandemic of its own, if I can use that.
Sure.
When I go into the over 55 communities, I'm not talking about the assisted livings, et cetera, but we're condo complexes, et cetera. There are plenty of people in there who have been isolated for 2 years, sitting in a little one-bedroom condo. And in most cases, I know that I'm going to have to, when we make a transition, I'm going to have to bring in my hoarding team to dig them out of what they have kind of created. And the reason for this, which is, it makes sense if you think about it, they feel that this is something they can control. You can control the fact that you have enough food, as you mentioned, or whatever, or you're collecting old newspapers and there's your stack of newspapers. It's a sense of not wanting to lose total control over a situation. And that, I think, is what the police officer was referring to when he talks about how much more prevalent he thinks it is now.
Yeah, and the other thing that I think you and I have talked about in the past as well is it's also more prevalent with seniors that are having cognitive issues. They will tend to go to the store, not remember what they bought, and tend to buy the same items.
You can always shop again. As one hoarder, self-identified hoarder said to me, you can always shop again. This particular picture here is what you would call random hoarding. There are, in fact, let's go to the next slide and we'll see that.
Oh, did I skip one?
That's okay. Anyhow, it was random hoarding, which looks a lot like the picture before it. This particular slide is of purposeful hoarding, where they are collecting things, paper cups. How many paper cups do you need? But they feel that they're doing something useful by collecting this and keeping these things. So that's purposeful hoarding.
So why would someone, purposeful hoarding on something like paper cups? What would be the mindset behind that, do you think?
Maybe they would run out. Maybe they don't know how many they'll need. It's, I knew a gentleman who collected old tapes. how many tapes did he need? But the sense was he would never run out of tapes because he had enough. And it may be the last thing that they feel that they can control because psychologically they're spiraling on some level out of control.
Mm-hmm.
So purposeful hoarding looks a lot like random hoarding, but it's not, because this one in particular, they were doing in the kitchen with things that they had in there and could use supposedly for everyday life. Let's go to the next one, please. Well, guess what this is? It's called severe hoarding.
Yes, those are what you see on the television shows.
And you can tell by just looking at it that one of the things is it's not healthy. It's physically and psychologically not healthy to have a house filled with clutter, filled with garbage. It can be dangerous. It can be dangerous to them. When I talk about, you go into a house and you see the little goat paths through the severe hoarding so they can get from one room to another room. I had a client I was working with. Actually, she wasn't even a senior. She was in her 40s. He walked into this little house she wanted to sell, and it looked fine until you got to 3 of the rooms, and the rooms were completely severe hoarding. But she didn't sense that she was a hoarder because she lived in this house. The rest of it was basically clean, but it impairs your health, and it can affect anyone else living there also.
Mm-hmm.
And also when people start saying, well, my mother-in-law doesn't want to let me in the house. I don't know if you've heard of it. It's because she's got hoarding that she's hiding, and
Right.
she's embarrassed to show it. So that can be what's going on in the severe hoarding.
Yeah.
And then of course we get to one which is the most common and one of the most severe types of hoarding, and that's animal hoarding. And that's the one that breaks my heart,
Yeah.
obviously. And it's just escalating and escalating. It not only affects the people living there, but it affects the poor little animals.
Mm-hmm.
And I've come across quite a bit of this animal hoarding lately. As people leave places, a lot of times they leave their pets there. They just abandon their pets.
And that becomes a legal issue on top of, clearly it affects another living thing, not a person, but another living thing. It's not, when you're hoarding stuff, you're really only affecting yourself. You're hurting yourself and your property, because I'm sure your property value clearly decreases because you're damaging it when you're doing this type of hoarding anyway. But the animal hoarding, it can definitely become a legal issue because you just can't do that.
And what's interesting is you look at the law in the various states across the country. It's actually, in some cases, it's considered states far more serious than in other states.
Mm-hmm.
And they call in inspectors, they call the Humane Society, they call the shelters to see how to get rid of these animals. And it's a real problem because the animals don't get along well in hoarding situations.
Mm-hmm.
The most prevalent kind of animal hoarding is, do you want to take a guess, Darlene?
Cats.
Cats and other small creatures.
Right.
Obviously.
And I would imagine that's because they're not getting them spayed or neutered or fixed or whatever the term may be. So they're multiplying.
And what will happen is they can fight. Cats become territorial.
Mm-hmm.
So you may have your cats fighting with each other within a property. There's also the question of the kitty litter. I mean, not to get specific about it, but cats don't like sharing their kitty litter.
Right.
So how many kitty litter boxes do you need? And then, of course, there's the situation of people outside of the home. And this is what the police officer was speaking to me about, where people abandon their pets when they leave.
Mm-hmm.
And then you've got a whole neighborhood full of feral cats that have not been taken care of and that are breeding. Mm-hmm. To the point that you can end up with hundreds of cats in an area. And he was talking specifically about some areas where he knows that goes on, and when they have to bring people in, And I know that people don't like this because people can say, well, what's going to happen to my cat? You know, and that's sad. But what he was telling me is they try very hard to save the animals that they can and see if they can be adopted, see if they can get, you know, the proper medication, the proper shots, etc. But in some cases, if it goes on too long, some of these animals have to be put down.
Right.
So to stop it before that gets there
Right.
helps everyone. Helps everyone.
But and I would imagine that, you know, based on, you know, your comments regarding the litter boxes and those types of things, that also can no doubt become a health issue, especially with seniors or older people that are staying in homes that have fecal matter and that type of thing that's not being maintained properly. That is a huge health issue.
And that's when the police get in, and you can actually, if the police come in, depending on what state it's in, some states make it an offense for animal cruelty.
Oh, 100%. I know that the state of Florida, at least in our area, is they're very strict on that.
Right, and you can be fined.
Mm-hmm.
And if you don't do something about it, you can get involved in criminal charges.
100%. And I would hope that there's some leniency based on, you know, the fact that if you're elderly, if you're a senior, if you have cognitive decline, that there's some consideration. I would imagine that there's, you know, there would be there are charges on that, but it would be, you know.
I think it depends. It depends on how the officials found out about it. What he was telling me is,
right.
A lot of times the neighbors are complaining.
Mm-hmm.
And then you've got someone else who has filed the complaint.
Right.
You know, and it's affecting their property values, it's affecting their neighborhoods, etc. So he said that's when it really gets serious. If someone complains that someone in the area is a hoarder, it has to be reported and it has to be investigated.
Right.
And
right.
It's sad. It's sad. Yeah. And I think the people that are hoarding these animals, usually it starts when a crisis is involved. Mm-hmm. And they feel that this is someone that they can still take care of. Mm-hmm. They're still competent. You know, look at my cats, I'm taking care of my cats. Well, in fact, they're not. They're hoarding them because there are too many. But that's the sense that they're still helping somebody or something.
Now, do you think that with especially the animal during like COVID may have increased that because of the loneliness in seniors and being isolated, that gives, because I know for me, I mean, I don't have small children at home anymore. I work from home, I work remote, I have my dog here, and sometimes she's my little BFF, you know, she gives me so much happiness and joy. And for seniors who are super isolated, they don't have, you know, I work, so I definitely am busy all the time. But if they don't have that, it just gives them that sense of responsibility, even though they're not being as responsible as they should be, because they're not fixing them, they're not taking care of them, they're breeding, they're just not making the wisest of choice. But sometimes there's that cognitive decline that's part of that decision making. But it's the isolation that's kind of ramping some of that up. Do you think that that's been a factor?
It's definitely been a factor. And then you add in, if a crisis hits, then all bets are off, because then you're grasping onto whatever, or the hoarders are grasping on what can they control.
Right.
You can control to some extent a house full of little animals. Yeah. And that's when it gets very, you know, and it's just the more I work with this, I realize how severe it is and how large the problem is. Right. The officer was speaking to me that it depends on where you are, but they consider if you've got 20 cats, you know, maybe 5 is acceptable, maybe. Yeah. You know, so they different.
I am not a cat person, so I think to myself, more than 1 or 2, I think is a lot, because I'm just not a cat person. But yeah, I had a friend who had 4 or 5 cats, and to me, I'd go over there, and 5 cats was a lot. And she had a large house, but they were a lot. It was a lot of cats. But she took excellent care of them. So
Yeah. Usually they will not consider 5 cats hoarding.
Yeah.
He said to me, you get to 10 or 15, and then there's some real issues involved.
Yeah.
Not to mention the fact that cats can be territorial.
Yeah.
You can end up with cat fights in your house.
Yeah. Yeah.
Which can be harmful not only to the cats but to the individuals involved. I had a woman many years ago that I ran into who she hoarded birds, and her house was full of birds and flying all over the place. And
what is that called? A planetarium? I don't know what that's called. It's
but it became a real problem, and especially when there's nothing else going on in their life, and a tragedy, a death of a partner or something can trigger this.
Right.
You've lost your partner, your husband of however many years. Right. Now you can get these cats and you can control that.
Right.
So that's the kind of thing that goes on with animal hoarding. And I'm gonna move on to the next one. There we go.
Oh, I went past it. So I'm sorry.
Well, this is cute. Have you sought psychiatric help for hoarding dogs? Hoarding psychiatrists get too expensive for all the dogs. I think that person was passing the buck on that one.
Yeah.
And I'm not trying to make fun of it at all, but you have to see the human side of it too, because otherwise it's not really possible to help people. If you go in and say to someone, oh, this house is disgusting, we have to get it cleaned out immediately. You're better off not even going in there, because you can clean the whole house up and it'll just happen again.
But so my question is saying something that to a senior that's hoarding, saying this house is disgusting, we have to get it cleaned up. Is that probably, I'm asking, I don't know. Is that an inappropriate thing to say? Is that going to be something that's going to move the needle, or is that going to be the opposite effect?
Well, the one thing you have to do, and I've preached this all along, is you have to be kind to people. You don't want to embarrass them, because on some level, and a lot of the people involved, they're not stupid. A lot of them are professionals, retired professionals, nurses, doctors, business people, and it's just gotten out of hand for them. And you don't want in any way to make them feel badly, because then you will not have their trust and you will not be able to help them. Right.
And do you think it's important, my guess would be, to kind of figure out where they are on, if there is a cognitive kind of part of the reason why they hoard? And I'm asking this based on I know I feel like I keep going back to this, and it's my dad had dementia, and he had early dementia when I kind of started noticing this. My dad was always very neat. He was never messy. He was never, didn't collect things. I mean, a little bit. He was, he had a few little things that he would squirrel away that my mom would fuss at him about. But our house, my mom never kept much of anything. Growing up, yard sales several times a year, or take it and put it at give it away. But we were not collectors, didn't have a lot of extra stuff, never. And my house was always neat as a pin, very clean. But after he started experiencing the dementia, the house started becoming very cluttered. And it was cluttered with more than enough dog food than any dog could eat. Buying cleaner, lots of cleaner, buying markers. And I don't know what the markers was about. I'm still unsure about that. But just started the hoarding with the decline of the dementia. So that was honestly, that was one of my signs that something was not right, because this was not normal for my dad. Because I would say, why, Dad, do you have, these big 40-pound dog foods bags for a Shih Tzu, and you've got multiple? I mean, I don't know, it'll take her 2 years to eat all this food.
And that's not uncommon. Let's go to the next slide. We'll deal with it there. Why do people become hoarders?
Oh, okay. There you go.
There you go. Risk factors have been identified in a study from the Mayo Clinic on why people are becoming hoarders. And it's really just a sign of the cognitive disconnect that's going on. No one is just a hoarder. You know, they have other issues going on, which is why I always refer to you need a group approach to helping a hoarder. It's not, you can't sit down with a psychiatrist and have 3 sessions and your hoarding gets cured. What it's really about is one of the things I do when I walk into, as you asked me, when I walk into a house where I see that there's a lot of hoarding going on. Mm-hmm. I may say, whoa, that's a lot of cat figures you have in here, but never insulting in that way. Mm-hmm. And you let them talk about it. And I actually asked the woman who had the cat figurines, I said, when did you start collecting? She said, me after my husband passed.
Okay.
I was alone, and very bright woman. You know, I was alone. We had a law firm that I helped him with, and after that was gone, that's when the collecting began. And never in the conversation did we discuss hoarding. It was about the collecting that went on, and you know what it means and what the distinction is. So that's what you need to look at, is what else is involved. I talked to a therapist recently who does alcohol and drug abuse counseling. And we were talking about adding a new category to the client list that she would see. And we were talking about hoarding being involved too. And in the meeting, they said, yes, hoarding is an addiction, just like alcohol and just like, you know, gambling, but it's not the problem. It's an example. It's one of the symptoms of the problem. And that's what we have to be aware of and figure out what's going on if possible. So got another one on the next page that is one of the newer forms of hoarding, cyber hoarding. And I'm going to say, a lot of you look at your computers, maybe you're walking the line on cyber hoarding, you know, get in there and clean it out. This is an example of what someone's computer looked like. How can you function on a daily basis if your computer looks like that? How many years worth of data do you need to hold? And that's a form that's become prevalent. And I think as people are getting more sophisticated about technology, you know, 30 years ago, we didn't have to worry about cyber hoarding. There might have been piles and stacks of papers, but now it's getting into the computer, and then it really gets into affecting life with the computer also. And so I say to everyone, and I write about this all the time, just go through and clear out your trash, clear out your junk, clear out any email or categorize it into another category that's more than a month old. Don't let this stuff sit around, because you can become a victim of cyber hoarding.
Oh boy.
I know people don't like to hear about that one, because that's
when it takes you a whole day to delete your Gmail emails, not a good sign.
Yep. And if you go to the next slide, we talk about some of the risk factors involved. Living alone in isolation, which you mentioned. Lack of cognitive stimulation. You're bored, so what do? The traumatic event seems to be a very, very serious stimulus of what goes on. And that's what we were talking about with the police this morning, that a traumatic event can trigger it, definitely can trigger it. And hate to tell people this, but there's a genetic disposition to hoarding, where if you have a member of your family who has been a hoarder, it's likely that you may go in that direction to a certain extent too. And it can be a red flag to what else is going on, you know? So it's serious. And obviously we talked about the isolation due to the pandemic and what that has done to people. And I think it'll be years till we know how great the effect has been. I had a very interesting phone call from a gentleman who was a president of a condo association. And he told me that hoarding is becoming a problem in this over 55 community.
Yeah.
You know, you've got the widows in there by themselves and they're hoarding. They're
Yeah.
trying to control something.
Mhm.
So, you know, he says, what do I do, Ann?
Mhm.
I said, well, let's see if we can help them. And they're not declared, you know, in this particular case, the woman's daughter wanted to force her to move, and it went to court. And the judge said, she's still competent.
Yeah.
You know, she happens to be a hoarder, but we can't force her to leave where she is
Right.
because she has these hoarding tendencies. So it can affect all parts of life. And usually when I talk about it, everybody goes in the same, what else? What else is going on? My sister-in-law, knowing that I was giving this presentation, said to me, her son's fiance's mother will not let them into the house.
Mhm.
And I said, we won't let them in the house. She doesn't want anybody to see her hoarding. Now, I didn't say it to her, but I'm going, red flag here,
Yeah.
red flag here. What's this family chemistry and what's going on, these family dynamics, that you have someone who is a hoarder, and will it at some point affect you or affect someone that you know? I think I've become a minimalist. We and I were talking about this. I've become a total minimalist. I throw stuff out once it's older than a year, you know, then keeping my tax records, etc., because I don't want to get involved in keeping too much stuff around. And as I tell people, nobody wants your grandmother's table. You know, that bit of collecting antiques,
Mhm.
that kind of, I'm clearing out a house now where they have 5 sets of dishes,
Mhm.
you know, and she lived alone after her husband passed. What did she need 5 sets of dishes for? The kids don't want them.
Well, you know, and that used to be something people would save and collect and pass down dishes. And we have a generation where they don't do that anymore. I know
Nobody
my
wants
kids
the
aren't
old stuff.
interested in anything.
Nope, it's a different time, and I think part of it has been created because we're you know, you buy furniture that's cheap, and when it breaks down, you get rid of it and you buy new furniture. I
Mhm.
can't get rid of, and I'm saying this if people are listening, if you have a big glass dining room table, I guarantee you nobody wants it.
Right.
You know, I mean, and people,
Well, it's even like I saved a lot, I mean, in a lot of my kids' stuff when they were little. I saved their artwork, I saved, you know, all their trophies, I saved all their belts from karate, I saved all this stuff. And now that they're grown, I'm passing the baton on to them. And both my kids were like, we're throwing this crap out.
they don't want it. They don't want it.
You know,
Which has some interesting implications. Will they not suffer from hoarding in the same way as the older generations? Because
right,
they don't have the sense that they have to keep stuff.
right,
It's a different mindset, which only time will tell.
right. For
But
sure.
I think it's important that people realize that it's a different world out there, and it's even affecting the world of hoarding. So maybe hoarding will disappear to a certain extent, except for the cyber hoarding.
Cyber hoarding will probably get significantly worse.
That's a prediction. I'll check in with you in 10
We'll
years.
see. Exactly.
And then the question is, after you've identified these risk factors, what do you do? And how do you help people?
Yes.
And that obviously is something that has to be addressed. You've got community care, you've got assisted living, you've got a lot of options. I know that when someone makes a transition into a assisted living or an independent living, they're not going to let you bring that stuff with you.
Mhm.
You know, when I clear out a hoarder's house, no, they can't take their things with them. They don't want them there because they're not clean.
Right.
They're not sanitary, and people are very, very cautious of that now. So
Mhm.
that's another factor to consider in all of this.
So so this is my question. When you are dealing with someone that is a hoarder that has to transition into an assisted living and they have to leave everything, that has to be something I would imagine that almost like a professional therapist or psychiatrist or someone that has to come in and help with that emotional transfer from that situation. I mean, it's hard enough for anyone making that emotional transfer from a home environment that they've had maybe their whole life, raise their children, into an assisted living. You really do have to, it's hard. I mean, I can't imagine it, because that's typically, it's a complete lifestyle change and moving from one stage of your life to kind of like almost the final stages of your life.
And people are aware of that. If you go to the next, just go on to the next slide.
Oh,
I'm calling them slides, but you all know what I mean. Okay. Hoarding affects the family. Just think, darling, one day all of this will be yours.
mhm.
And I think some of the people listening or watching can go, oh yeah, that sounds familiar, you know. And then when I clear this out, I have developed a strategy that I use, and I don't know whether you can see this or not, but this was, see if this shows up on here. This was a book I made for the woman who collects the cats.
Ah,
And I call it a memory book.
okay.
Now, whether she will take the clue from this,
We're having a hard time hearing you. If you could
whether
that.
she will take a clue from this, and now she will have this book of almost her entire collection. Will she let me clean the place out so that her life can be easier? I don't know, but I do know that these memory books, and doesn't even have to be someone that's a hoarder. I make these memory books for any senior that is transitioning and leaving some of the things that they love, or they have to downsize, they have to sell them. And they take them with them in a memory book. You know, you just make them, you know, everybody can do it with photography. It's just a very useful technique I found, and people really, and the families appreciate it.
Right.
Look, mom can take this with her, and there's her couch, and there's her artwork, and blah, blah. It helps a little bit. It's amazing how they cherish these books.
That is, I love that idea, to take a book like that, create a scrapbook of the things that are important to them. And yes, they're things, but to them, it's a memory book that they can look on, especially if it's their home, it's what they're leaving to go into a different environment. They can still look back on it. I like that.
I had a condo that I was clearing out, and the woman was going into an assisted living, and her daughter had lived with her, and her daughter had passed about 5 years earlier. And the condo was very neat, except for her daughter's room, which she had not touched in 5 years. And this was becoming a psychological issue. She couldn't leave the house because she felt like she was deserting her daughter.
Yeah.
So we made a memory book of the things in her daughter's room.
Oh, I love that.
You know, I'm not going to share it because it was pretty private, but
Right.
but she took it with her, and that was a way to transition with some of those memories. So a lot of these strategies we're talking about can work with people who are not even necessarily identified as a hoarder or you know, a specific hoarder, but it can help any senior in transition, I think.
Yeah.
So you want to go on to the next one about who can help, and then go on to the next one because we kind of covered this one. Next one. Assistance is available. Ta-da!
I know we have some of those questions already popping into the Q&A, so you might answer them before we even get to Q&A.
Okay, well, I have teams that I work with who work specifically with me in cleaning out properties that are suffering from hoarding, and they do wear masks. We are careful. I'm very careful because you don't know, as you mentioned earlier, what all's been going on in that house or in that condo. But there are especially trained crews that can come in and they help me, and they do it in a sanitary way. And as I said, nobody's going to want the couch in that. No assisted living is going to let you take that couch into the bed, into your apartment with you. And you know, and people are understanding. The crews are good, but you can't just clear it out and say everything's going to be all right. I had a terrible situation where someone called me, and I'm not and they said, they're clearing out a hoarder's house. Can I help? Because they knew that I was an expert on it. Well, the gentleman who was clearing out the house didn't want me to become involved, because I said, well, we have to get adult protective service involved, et cetera, et cetera. He said, no, I'm going to clear the house out. I'm going to finish my work on the house, and I'm going to move them back into it. There was nothing I could do about it.
Mhm.
You know, his clients, you know, he didn't want to take the advice because he was worried about losing the business.
Mhm.
So there are all sides to this and all kinds of ramifications if you're not careful about what you do. And the reality is not everybody's as sympathetic as we are.
Mhm.
What are strategies if you go on to the next one? Make a concrete plan. Embrace various techniques for the cleanup. Obviously, we talked about this. Provide assistance with the underlying psychological issues. And you have to follow through. You can't clean the place up, collect your fee, and walk away. That does nothing. And that's, I think, my problem with the reality TV show. I think that it's given people the wrong impression of what you do about hoarding disorder. And, you know, the crews come in, they clean it up. That doesn't help if the family isn't involved, if there isn't a plan, if there isn't a psychological intervention. It's a waste of time and money to do it.
Right.
And it's something that has to be looked at. And I always say, please, what team is going to be involved? And I'm talking about the team of support, the family members who are going to become involved. I need someone that I can talk to who can help to determine a plan so we can make a healthy transition. And that's probably one of the most critical things, to find someone. It could be an aide, it could be hopefully a relative, it could be a dear friend, but there need to be other people, support people involved in this. It's hoarders are lonely enough.
Yeah.
And if you take their things away from them, there better be someone there to kind of booster them and hold them up.
Right.
And help them. So that's it. Next slide. And there we go. I was talking to her about the animals.
The animals. So one thing that I want to mention, and I just want to highlight this, and then we're going to do our Q&A because we only have a few minutes, is I like the way that you approached it. I think I want to just highlight this for anyone that works with seniors, works with the elderly, to approach it in the most compassionate way, instead of saying, when did you start the hoarding, or when did you start collecting this, or when did you start collecting the cups? When did you start collecting cats? That to me is the best, simplest way of kind of starting to find out the root of the problem of why this is kind of started, so you can start fixing it. Because there's a reason why people start doing that. It's not just because they love cats.
You're exactly right. And
Right.
The way you phrase it is that, like,
Yeah, it's the simplest way to get in there.
Yep. When did this all start? When did you become so interested in it? And how did it grow to be such a large part of your life? You're absolutely right. That's the question to ask.
Right. And it's so conversational. And if they like doing it, then they're going to talk about it. And I think that that's a way to open it up and make it more of a conversation versus an accusation, which I think the other way it would come across as I'm looking down, accusational, and in a negative way. So,
and if you're being judgmental, they'll throw you out.
Yeah, and they'll shut down.
Yep, exactly.
100%.
Exactly. And that they will not let you help them because you've insulted them.
No. And about the hoarding regarding, just cleaning it out, the cleaning out will take care of the hoarding. That'll solve the problem, but it won't stop the hoarding. The hoarding will come back because it doesn't help the person. It's like an alcoholic. You take the alcohol away from a person, that doesn't stop him from being an alcoholic.
Well, and also sometimes if you clear it out, and I don't want to take up too much time, but you can get in a case you clear it out and the person can have a true anxiety attack.
Yeah.
Because these things are gone. So you've not helped at all. If anything, you've put them into more trauma and made the situation far worse. You're dealing with a mental disorder, and it has to be treated cautiously with kid gloves and with, as we say, a lot of compassion, because it's unfortunate, and I think it affects a lot of people.
Right. And then, you know, I keep going back to the dementia side, but just knowing how this affects anxiety, something like that, a traumatic experience with someone that has dementia will just make that dementia even worse.
And manifests itself possibly in other ways.
Yeah.
You know, in depression and isolation, and last slide, and then I'm willing to see what questions people have.
Okay.
Many hoarders can be assisted to live more meaningful and productive lives. And I just want to say that if I am open resource, if people need help, I don't mind taking a phone call. I don't mind taking an email and directing them, no matter where they live, in the right direction to get the help they need. And one of the things I do as a senior real estate specialist is I train other realtors on what do you do when you see a hoarding situation. And the police officer and I were talking about that and the training that some of his people need. And he said, how about, can we look at your website and your videos? I said, absolutely.
Yeah.
You know, let the officers see what's involved.
Yeah.
So
with that, I didn't mean to interrupt you. We'll send out all your information when we send the link so that it can contact you, but I'm going to get some of these questions out because I don't want to miss that. How do you correct or help the hoarding problems? I think we kind of answered that a little bit within because I know some people ask these questions. If that's something that we don't feel like we answered, please reach out to Ann directly. Now, Beth asked this question. I'm confused. 2 to 6% or 15% show hoarding tendencies or hoarding diagnosis.
Well, a lot of
she says that Fort Lauderdale police estimate 15%. I'm confused on this.
That's what the police said to me, about 15.
Oh, that's what the police said. Okay. If you have a question, please just put it in the chat box. Or I'm not sorry, not the chat box, Q&A. The chat is for some reason disabled, which I apologize. I must have done that.
And as I said, we don't even know what percentage it is, because so much of it, especially the poor isolated seniors, you may not find out until you go in there because they've had an accident or something that's happened. You know, you don't necessarily know who the hoarding is, especially if they're locked in a little studio somewhere, and that's it. You know, I think it's very, very prevalent. And when he said that to me, 15%, and it depends on where you live, your socioeconomic level, what's involved, but I think it's far more prevalent than we think. Every time I mention it, somebody says to me, oh, that's my aunt, or that's my girlfriend, or everybody knows some hoarders.
Right. And then Beth asked that hoarder is a diagnosis.
Hoarding disorder is now a specific diagnosis.
Okay.
Yes. It used to be part of OCD, obsessive compulsive disorder, but now it's got its own place in the psychological literature, because they know that it involves far more than just OCD behavior.
Okay.
So
without a diagnosis, the person shouldn't use the term without a diagnosis. Is this accurate?
Well, hoarding is a term that not everybody's happy with throwing around.
Right.
You know, collecting, or boy, that's a lot of collecting. I use collecting a lot because if I scare or upset someone, they're not going to want to work with me. They're not going to get the help that they need.
Amanda asked the question, what solutions do you recommend to work with someone that already has a hoard?
Well, I think what I propose is you get the group involved. You involve someone in the family or someone who's related to the person who's willing to help. And from there, you build the rest of your team. You know, it may be with someone in the assisted living they're going to, it may be with a psychologist who's available, but you have to have support. You can't do it alone. You have to have a team approach. So you identify those individuals who can help the senior, and that's how you start.
So Amy asked the question, what if assisted living or community care is not affordable? Is there other social workers that can step in? I'm asking that part myself, but.
I'm in a healthcare group that works with some counselors who do Medicare, are paid by Medicare and Medicaid, and we can involve them, and I seek them out sometimes. But it's tough because it costs money to clear the place out. Usually medical and psychological help may be necessary, but there are channels to go to, and even involving community services.
Right.
So it depends on each situation, let me put it that way. But
right. I'm wondering if, let me think about that. Email me, the person that asked that, and let me see if I can't get a answer to that. Because I'm thinking that there's, in each state, in each community, there's an outreach for seniors, and I can't remember the name of it, but I might be able to get that.
Yeah, there are community services, and I was talking to the police.
I can't remember
about
the name of
that.
it. Yeah, something of aging. Can't remember. And then I had the question, what is your suggestion for residents are hoarders but live in skilled care facilities? Some of these residents, I guess, hoard like all the pieces of paper, and they're connected to each individual piece. This is really hard because that's all they can control when they're living in a skilled nursing facility. That's going to be tough. What's the best approach to help them that is compassionate as possible?
Okay, well, I cannot march into one of those communities unless I'm invited to come in there, because I don't want to interfere with what.
Right, but what would you recommend that they do?
Well, they have to develop a plan. They
Right.
have to develop a plan of support. I'm sure there's going to be some counseling involved. But when you move them in and they are hoarders, first of all, you don't want to move all that stuff in with them, but then they collect it there. Then they need counseling. We need to get counseling involved to help them rather than just clearing it out. You make rules, but sometimes older people are like kids. They want to break the rules too.
Right.
So I think you have to take a counseling approach, and and a lot of times I speak at assisted livings, and you'd be amazed at the number of people who show up.
Right.
And clearly, this is an issue for them, and they're thinking of moving into one of these communities.
Right, but this is a skilled care facility, so it's a little bit different. So I almost feel like maybe, I don't know that what that solution might be.
Yeah, it's a tough one.
That's a tough one, especially when it comes to paper. I don't know. I mean, I think that would be an individual approach, I would imagine. And then also would involve the family, I would imagine. But that's just, just coming from me, just, brainstorming.
Yeah, each situation is different. Each
Yeah.
situation is different. It depends on how receptive, they are to help.
So I have a question. Is hoarding like I don't know what this means, in the DSM-5?
Yes.
It is. Okay. So it is part of the OCD. Okay. Would you have the same approach with residents who live in assisted living and memory care with hoarding?
Well, usually when they get in, I don't see large amounts of it going on in there because usually they don't allow it. You can't move in with your clutter. So
right.
Basically, you got to start all over again when you get in there. And again, it's
right.
and I haven't necessarily done a group on it, but when I give these speeches and people come up to me afterwards, they're asking for help.
Yeah.
So it's almost a form of counseling that they need.
Right.
And it's the same thing as we were talking about addiction counseling. What do you do when someone has a serious problem like this?
I think when they get into a assisted living, I do know that like after my dad passed away and we were there was a lot of stuff that he had in there, like furniture wise, and some things that we were like, he had a little refrigerator and things like that, that the assisted living came because some of the residents, a couple of them started like, can we have the assisted living came in and said, do not give anything to anyone here. You need to take everything out. Do not give it to anyone. And I was like, okay. I thought it was strange at the time, but I'm kind of realizing some of the folks that were asking for it had a lot of stuff in their room. And I have a feeling it was because that's what they did. They would see stuff. Yeah.
And I think since COVID and over the last couple of years, we've seen this, they're even getting stricter about that, because I can walk into a condo and we'll be making a transition and I say, buy them new furniture. Or take some money out of the sale of the condo and go to, one of the furniture stores and order all new things.
Yeah.
Because you can't just take it with you the way you used to.
Yeah.
Other than some pictures, sometimes they don't let people, as bring anything in, and you got to get new linens, you got to get new bed.
Yeah.
You got to start over.
Yeah.
And that's actually, you brought up an interesting idea for workshop. Maybe I'll do a workshop on what do you do when you're a hoarder moving in, and what are some strategies for the community.
Right. Yeah. Because that's got to be a problem for them. So I have a question. So how far can you, so Joanne writes, how far can you push a client so you don't add more trauma for them?
How far can you what?
Push a client so you don't add more, I guess, push a client to not hoard. I'm not sure what that
means.
means.
Well, one of the things, and sometimes it's called tough love. In the case of animal hoarding, I mean, and you have to talk about reality. If we don't do something about this, then the police are going to come in and it will get done for you. And I hate to say that, but there's some tough love involved. It depends on how severe it is and how much it's endangering their situation. But I had a client who has become a hoarder as she's gotten older and sicker, and I was in her condo, a little house, with the social worker doing placement, and I said to the social worker, I'm telling you right now, we've got to get her out of here. I can feel it. I can feel it, and you just get a sense when the crisis is going to escalate. And once you're on the floor and 911 has been called, then the rules completely change, because they will take control. So one of the approaches is to say, let's take control of this situation before it becomes a crisis. It's crisis intervention is really what it is. We're talking about.
So I have Janine who asks, where can I find behavioral health care professionals to help my clients? I'm a senior move manager that assists with these clients.
I guess they have to look in their community. They have to reach out to the counseling available in the area. Senior real estate specialists are trained. They're trained by the National Association of Realtors to help seniors in distress. So that might be a place to go. If they contact me, I'll tell them who in the area can be helpful and what kind of realtor can be involved to help.
Okay, so Sylvia asks, how would you help someone to get rid of excessive clothes and does not think it's a problem because she thinks it's just a room, the room is too small? Sylvia, stop talking about me. Because I might have that problem.
Well, I have a rule, which I don't know how much it has to do with hoarding. I tell people who have a lot of stuff, you may not buy anything. Whenever you buy something, something has to be thrown away.
I like that rule, and I would love to stick by that. It's hard.
We all suffer from that, especially because we've got clothes that we haven't been out in the house. But I don't buy any piece of clothing without discarding another piece of clothing.
So maybe try to make that rule, don't buy anything unless you get rid of something and make that deal. I know that I have a cousin who does that with her child. With clothes and toys, you get a new toy, a toy has to go. So is this toy really that important?
Exactly. Exactly.
Is this dress really that important? And she's raised her daughter, who's now 8, that she's done that her whole life.
I mentioned in the podcast we were talking about a gal who stood up at a meeting and said to me she took all her things to Goodwill because she was trying to declutter. She bought them again. She went back to Goodwill and bought them all back.
So we are going to have to sign off because it is 3:11. We've gone way over, and I never do that. I always want to stay within 2 to 3, from 2 to 3 every time we have this, but it was a great podcast. I do want to mention Elizabeth. Thank you. It's Area Agency on Aging, which is an excellent resource, and they should be available in every state, from what I understand. Would potentially have, if your senior that has a tendency to hoard does not have the ability to attain funds for an assisted living or a care management of that sort, can maybe contact them and get some help from Area Agency on Aging. Thank you, Elizabeth. You rock. Anyway, so that's all we have today. If you had a question and did not get answered, I'm so sorry. We did run out of time, but you do have Ann's information here. Please reach out to her directly. She will be happy to answer your question. And we will be emailing this out with her information as well. If you're not able to catch it right here and now, look for that email. And we'll also have my information. You're welcome to reach out to me, but I probably cannot answer these questions for you. To the ability that Ann can. It will also have a link to our podcast, which is a senior and caregiver focused podcast. So it's got a little bit of different information on it as this podcast, and it can be listened or downloaded anywhere you enjoy music, such as Spotify, Apple Podcast, or anywhere else that you enjoy music. And I think, oh, I didn't mean to do that. But I think that's all we have for now. Thank you everyone for joining us, and have happy holidays, because we will be back in 2023. Thank you, everyone.
Thank you.